Physician, first heal thyself.
Who are you?
I am God. You surgeons endeavor tirelessly to benefit your patients and science. Yet it is sad that you are not paying attention to your own well-being, to the ergonomics of surgery. Posture perfect. Ergonomics for the ophthalmic surgeon. The fundamental fact is that your limbs are supported by the body core. So, it is only natural that stresses on the limbs will mean direct stress and strain to the neck, shoulders, and back. And the weaker your core, the more the impact. Let us closely evaluate the elements that will enhance comfort and efficiency in the operating room. Ergonomics of the surgeon's chair. We see varieties of awkward operating chairs, ranging from simple stools to chairs without meaningful back or elbow support. Forward flexion is often the natural posture during surgeries. Operating without a back support aggravates the weight-bearing stress on the vertebral facet joints. This recurrent and persistent trauma may lead to arthritic changes and restrictions within the joints. Similarly, in order to maintain steady hands while gripping fine instruments for a prolonged period, if there is no elbow support, the entire stress is transmitted to the shoulders and upper back, leading to chronic fatigue and tightness in these muscles. Ergonomics of an ideal surgeon's chair. An ideal chair height is one where the surgeon's feet can rest on the floor. A seat that is too high may force the surgeon to move forward to a point where it is difficult to maintain the S shape of the spine. Backrest should support a large part of the back, particularly the lower back, and should conform to the natural curve of the spine. A good lumbar support is when the ears, the shoulders, and the pelvis all fall into one line. Armrests that are too low result in unsupported elbows. Contrarily, armrests that are too high restrict the range of movement at your wrists and may put undue strain on the small muscles of the hand. Therefore, surgeons, invest in a chair that has suitable back and armrests, which are easily adjustable in the seated position. Ergonomics of the operating microscope. While you pay a lot of attention to its optical details, the ergonomic aspects of a microscope are often neglected. The eyepieces of the microscope should be tiltable so as to be aligned with the surgeon's line of sight. If not, it may lead to undue flexion for tall surgeons or undue extension of the neck for short surgeons. Not only this, the microscope should be lightweight and easy to maneuver. As more and more external attachments get added onto the microscope, it not only becomes heavier, but also ergonomically awkward. Ergonomics of the foot pedal and operating table. It is important to have a foot pedal with a minimum range of travel so as to keep the muscles of the ankle and foot relaxed. Wireless, lightweight foot pedals give ease and extra maneuverability for both the surgeon and the OR staff. Similarly, specially customized contoured tables with a smaller base suited to temporal surgeries are the need of the day. Operating room ergonomics. Although a lot is being said about posture, seldom are the ergonomics of the space where surgeons spend a large part of their working lives discussed. We often see that cables may run across the floor, creating a threat for falls and injuries. It is wise that the electricity, gas, and networking cables be dropped from the ceiling using a pendant, keeping provision for futuristic upgrades. If this is not possible, all efforts should be made for safe cable management. Ergonomics for the patient and assisting staff. Often the most neglected during surgery are the assistants and patients themselves. In this era of topical anesthesia, where patient cooperation is key, Making them comfortable using adjustable tables, tiltable headrests, and soft cushioning support makes the surgical experience pleasant. Stereoscopic viewing through assistant microscopes or conveniently placed viewing monitors make assisting more efficient and comfortable. How can you surgeons safeguard your health at the workplace? Well, it is quite simple. Invest in your health. Take time out, even if it means between surgeries. And who better than your own colleagues to give you an advice?
I really don't think about the long-term consequences of what you do every day. I found that after about 10 to 15 years, I was developing constant chronic neck pain and upper back pain. And there's no doubt it was the positioning at the microscope was leading to the problem. Therefore, I started on a regimen of exercise to really emphasize strength in the core of the body. And it really has helped my core strength and that I'm in less discomfort. In addition, we incorporated the 3D system in the operating room. I don't have to position myself in the oculars. I can sit back in whatever relaxed position I want. I would urge all ophthalmologists, those who are just starting in practice, and certainly those that have been practicing for a long time, to consider routine exercise.
So attention to ergonomics is very important. One of the most important things is that if you sit straight on temporally to make a temporal clear corneal incision, your right hand is going to be squeezed into a very unergonomic position. If I offset my body and also the microscope about 10 degrees to the left, it made for a much more comfortable and ergonomic entry into the eye.
Here are some simple exercises all of you can do. So, my message to you is, be aware of and take measures to improve your work ergonomics. For in the end, it is so simple. If you want a miracle, be the miracle.
So, thank you very much for this elaboration.
Any questions, sir? Thank you so much. Dr. Oshin is here.